It's live from DeFabio Spine Sport Rehab. It's a great day to talk rehab about what? About shoulders. Why did I pick shoulders? Well, guess what? Number one, it's probably the most non-spinal part of the body I make. Well, Mike, thanks for coming out today. I appreciate it.
Hello,
yeah.
everyone.
Yeah, Mike's here. Now we can get started. Let's start all over. No, seriously. This is about shoulder impingement. This is about people who have shoulder pain. I saw 3 shoulder syndromes this morning, first-time patients to the office, and it's common. So what I did for you, for the people that suffer with shoulder pain, is I went online and I find out what's the best treatment out there for shoulder impingement syndromes, because that's what these 3 patients had today, which was where the tendon of the rotator cuff was impinged or pinched between the collarbone and the arm bone. So there was a research study just published in May 2017 in the Orthopedic Journal of Sports Medicine by Punjabi. Nejati, N-E-J-A-T-I. You can look it up yourself. And he did 2 groups of people. One got injections for the shoulder, and one did exercises. To find out injections, specifically he used PRP, platelet-rich plasma, at a very specific concentration. So I want to applaud him for writing down the exact concentration of the PRP he used, because all PRP is not equal. So that's a whole nother subject we can talk about. Just because you get PRP from one doctor doesn't mean you got the same PRP concentration from somebody else. Very different way it's prepared. So he had PRP, injection in the shoulder with one group, and the other group was an exercise group. And guess what? Both got better. But the exercise group had better results. Why? It's real simple. Because the exercise group treated the underlying cause of the impingement syndrome, not just the symptom. The symptom of the pain and the inflammation. The cause is this. So exercise got people there. So we're not going to go over all the exercises, but he broke it down to 4 basic groups. The first group was passive range of motion. So just some stretching. Mike showed people, doctor, you want to hand me the stick there, the dowel? That or the white one, that's fine, the white one. There we go, that's red, but that's okay. I meant the flesh tone. Anyway, so just passive range, the long one, the long dowel. This is live TV. Now you can tell this is this is live TV. That one. So let's just do some range of motion activities. Passive range of motion. You can use a pulley. If you use this hand to push, that hand's moving passively, right? Do an external rotation. So bend it 90 degrees and push. Passive range of motion. They also did isometrics. Okay? Isometrics were, go ahead, just demonstrate, push out like that, okay? Keep the arm down and push out. So his first phase was passive range of motion and isometric. They did that throughout the day, 8 to 10 times a day. When that got easy, then they went to show them some scaption. Some exercises in scaption with resistance up to 60 degrees. Yeah, you can use a band, okay? Not above 60 degrees. They did going up and down in the scapular plane, in the plane of the scapula, okay, like that. They also did internal and external rotation with resistance in a short range of motion. Go ahead. So that would be internal, short range, give them half range, okay. Limited range of motion, good. And then external, you can hold it yourself, was the second phase, okay. They continued with the stretching, but not as much, a little less intensity with the stretching. All right, so that was the second phase. When that got comfortable, 3 sets of 10 on those, by the way, with the stretch band. They went to the same exercises above 60 degrees in scaption. So bringing the arms above shoulder height. Again, scaption's not straight out, not straight forward. It's in the angle of the wing bone or the scapula above. And then your internal and external rotation were done at 90 degrees. All right, which can be done. Let's just stand on it for that one. You can do it standing, or if Mike was lying down, it works really well. You loop the CLX band over the foot, and then you can do internal and external rotation. External that way, and then internal, you'll have to, you would come this way. Now he needs my help. So he knew he needed my help. and that would be internal, okay? Starting with a short range, building to a full range. The last phase, the fourth phase, again, 3 times 10 on that, was using a medicine ball for tossing overhand, underhand, and soccer style. So medicine ball tosses, back and forth. I don't know, you come a little closer, Mike. Make sure you're in the shot. You gotta make sure you're in the shot. Okay? And this is great as you're doing tossing, because it's not only good for your shoulder, it's good for balance. And watch my video on just tossing a ball for better balance. So anyway, do you have shoulder impingement syndrome? You have a choice. Treat the cause, treat the symptom. Exercises, therapeutic activities have been shown in the research to give better results by fixing the problem. And when it comes to postural correction, Najati talked about that starting in the first phase. Starting in the first phase. So to get rid of this, you got to start with posture, stretching the tight muscles, strengthening the weak muscles. It's a great day to talk rehab. Thanks for tuning in. We'll see you next week.